You're listening to Prevention is the New Cure, the Health and Politics podcast with former ministers Steve Brine and me, James Bethell.
Hi, James. Early happy Christmas. How's your preparation going?
Oh my goodness, we are absolutely drowning in tinsel and presents here. We're doing a
Nice.
traveling Christmas. We're going to Japan and then to visit family in Taiwan. So everything's having to be crammed into suitcases. And so only small Christmas presents are permissible.
Of course, yeah. Well, of course, Santa will find you wherever you are.
Indeed.
But
Particularly
yeah,
if
we had
if you've got
yeah,
Christmas stockings and all the little bits and pieces necessary already in the suitcase.
nice. Do you do a stocking for Mrs. Bethel?
Yes, of course I do. Yes.
Do
Yeah.
you?
Yeah. No.
Hmm. I have normally done one, but I don't think I've got enough items that will fit in a stocking. Not to say that I've got any big items either, but I think I've got work to do.
Yeah.
We went
Well,
to the first carol. We went to the first carol season, carol service of the season yesterday at my son's school, which was rather jolly. Got everyone feeling quite Christmassy.
yeah, I've done three already.
Have you had three already? My
Yeah.
goodness.
Three children, three carol services.
Oh, well done you. What else you been up to?
I haven't had much time for anything else. Um, we are busy in the House of Lords doing legislation, just winding up the tobacco and vapes bill and struggling through the early dying bill. So health is big. The tobacco and vapes bill pretty much thumbs up. I mean, the issues around vapes are controversial, and I wish they had gone further on tobacco, bring in an extinction at 2040. But that's basically in good shape. But the early dying bill, oh my goodness, Steve, it's a total mess at the moment.
Well, it's interesting you raise it because Kim Ledbetter, who we both know well, and I talked to when she came out top of the ballot and introduced her bill. I saw something this week reported that she said there's going to be a constitutional crisis around the assisted dying bill. What does she mean by that?
There's a very strong feeling amongst a lot of MPs, particularly Labour backbench MPs, that the bill is fine. They're happy with it. They took it through committee at their end, and that there is obstructionism and deliberate wrecking going on in the Lords. But in the Lords, there is a very strong view that it may be a good mission and an admirable thing to try to achieve, but the bill itself is broken, is poorly thought through, unevidenced, and leaves too many gaps about basic regulation. And it's as simple as that. These two sides have got a huge gap between them. And what Kim is saying there is, listen, we voted for this. We're the Commons, get into line. And what the Lords are saying is, hold on a second, we know a thing or two about scrutiny, and this one's got a massive set of holes in it. And until you fix it, we're not going to let it through. So yes,
Yeah.
it is. They've gone toe to toe. They really have.
Yeah, but it's your job to do the scrutiny, isn't it? I just wonder, at what point does Morgan McSweeney turn around to the Prime Minister and say, what on earth are we doing? Distracting
I
from the
know.
message on health, let alone anything else, on an assisted dying bill. And I just wonder whether those conversations are already being had, given that the Health Secretary himself voted against it at second reading. The Home Secretary, then Justice Secretary, voted against it at second reading. To me, I mean, I don't support the bill and wouldn't vote for it if I were in the House, but I just think it's a huge distraction for the government.
It's 10, they've put in 10 days of Fridays. So it's quite a lot of money. It's a huge amount of parliamentary time. And this is a moment when they can't get some very basic stuff through Parliament through lack of scheduling space. No, they've really got into the weeds on this. I'm different to you. I would support the intent of the bill. I wish there had been a Warnock and a really good piece of parliamentary process around designing something really thoughtful. I regret that this is a slightly shaky PMB that doesn't have clear government and civil service analysis and work done, polishing done on it.
And yeah, so right at the start of the program today, we're just going to focus on the big story, I suppose, in health and politics right now. Certainly this week is the flu epidemic, as described by many, and how that's presenting in the acute sector. So the immediate past president of the Royal College of Emergency Medicine is Dr. Adrian Boyle. He's been on the podcast before. Welcome back, Adrian. Just how bad is it out there in emergency departments at the moment?
Yeah, it's pretty tough. I mean, on our WhatsApp groups, everyone's saying it's crazy busy. And what we've got is that flu has come early and it has come hard. Normally, we see this sort of pressure a couple of weeks later. Sometimes we actually see this in the first couple of weeks of January. We always know that there's a media bun fest around pressures in emergency departments, which is the first 2 weeks of January. But actually, things are going wrong right now, and the WhatsApp groups are buzzing with how much pressure people are feeling at the moment.
What does going wrong look like in practice? Does it feel like 2020, 2021 out there?
Well, 2020 was the year of the pandemic, which felt very, very strange. 2022 was where we got these enormous spikes in ambulance handover delays. You dragged me in front of the Health and Social Care Select Committee to interrogate me about comments I was making in the media. We are seeing an awful lot of people staying more than 12 hours in our departments, and we're seeing quite a lot of pressure in offloading ambulances. I know the phrase offloading sounds quite industrial, but what we see is ambulance waiting outside emergency departments and unable to go to the next job.
So you've mentioned in other places vaccines and the fact that the vaccine came late. How big of a contribution has that made to the problem?
Yeah, so the flu vaccine is it's an important thing that we do. We've had slightly muddled messages around to the public around this. Most older people do get vaccinated if they're invited. I don't think there is actually nearly as much anti-vax sentiment as we see with other vaccines.
Yeah.
I think where you get low vaccine rates, it's actually about convenience and ease. Much more around, does the system make it easy for people to get vaccinated or not? Staff vaccination is a huge concern. And we've seen massive variability in individual trust and how good they are at getting their staff vaccinated. And this is basic, simple, good management and organisation. Make it easy and convenient. I work in a hospital that's been quite good at getting people vaccinated. They have people who will go and do little outreach things, going to the wards. They'll try and catch the night staff as they're going off duty. They make it very, very easy to catch people, but I don't think that's routine.
Yeah. And Adrian, how do you think this is going to play out? Because as you say, it is early. We don't normally have these conversations until January or February. Are you hopeful that things will come together, or are you raising a red flag?
I would say I think it's time to raise a red flag because we're actually going into this winter with less beds in acute services than we've had for a number of years. We're 500 beds down than we were this time last year. And, beds isn't the only answer, but without beds, you're pretty stuck, particularly when you've got somebody who needs to be admitted.
And will the beds get freed up? Because traditionally there's a pre-Christmas clear out. A lot of people get sent home. That might be in other parts of the hospital, but it can ease pressures on you so that you can move some people out of your EDs into other parts of the hospital. Or as we've discussed before, is the whole pipeline jammed?
I think, yeah, the sort of Christmas clear out makes you think, oh, if they can do this just before Christmas, why can't they do this all the time during the year? Actually, what's happening is people are not doing elective surgery on people before Christmas because we know that's a bad time to put someone through a big procedure when their social network isn't going to be as good and the cover within the wards won't be as good. So that clear out before Christmas isn't such a big deal. That clear out before Christmas and creating a little bit of capacity, that's great. But, 27th of December, it all comes crashing down. We know, looking at shifts, I talk to my colleagues, I would much rather work Christmas Day than Boxing Day because we know there's going to be all this pent-up demand of everybody turning up.
Adrian, Secretary of State, was on the media last week talking about his promise to end corridor care by the end of the Parliament. Presumably, one of the ways that this crisis, this flu epidemic, is presenting itself is that corridor care is, and I quote this, endemic in the UK now. This is a big story in The Guardian today, a new academic study that's been published in The Guardian today. What does corridor care look like? What are you hearing from your members?
Well, it's not just what we're hearing from members. I mean, you're talking about an academic study that was published in our own emergency medicine journal, all our trainees got together and they went round and they actually measured at 5 different time points in March, which is normally actually a pretty good month,
Yeah.
how many people were waiting in corridors. And they found that about 1 person in 5 in an emergency department was in a corridor. And that didn't vary very much during the times they used. They'd use times when they thought it'd be busy, but they also used times when they thought it wouldn't be busy. And if that's March, heavens knows what it's like now. We know, and you can see it when you go into work, there are lots and lots of elderly, sick people waiting to be admitted into beds, and they're on corridors. I am really pleased that Wes Streeting said last week that he has a commitment to end corridor care by the end of this Parliament. But I would imagine the moment he did that, there were a lot of brows amongst the SPADs that got very, very furrowed. Because actually the commitment's great. The harder question is the how.
Presumably, that's going to require a lot of capital investment.
Yes, but not necessarily in the traditional places where we've put it into. I think there's a bit around, this comes down to, do we have enough beds? Do we use the beds efficiently and well? And, one of the things the NHS is terrible about is we measure what can be measured, and then we try and put a lot of effort onto that bit that can be measured, where without taking an end-to-end approach towards it. So we don't do very much measurement of what actually goes on inside hospital. We're fairly good at measuring what happens before, and particularly with ambulances, we measure that in seconds. In an emergency department, we will measure that in minutes. Once somebody is in a ward, we measure that in days, sometimes weeks. And it's not really used to try and drive improvement.
Yeah.
And, there's bits to it. There's better efficiency within hospitals. There's also that big problem of social care that no one is a nettle that no one wants to grasp at the moment.
Yeah. And that, Adrian, is your big riff, isn't it? That you can do everything you can to optimize and productivity in the front end of the building. But if the back end door is shut and you're not getting people out, then you're going to get bodies stacked up and it's impossible to move people through the organization. And you're basically living the problems created by our failure to provide adequate social care so that people can leave hospital.
Yes, though there's a degree of othering around this. It's very convenient for a inefficient hospital to say all our problems are around social care,
Yep.
all our problems, and social care to say no, it's all the acute trust. It's a bit of both. The Nuffield Trust looked at this and they sort of said it's about 60% social care, 40%. Now I don't quite know what they mean by 60%, but it's a bit of both, and that needs that leadership to grip it and go, what are we doing? Why are we keeping all these people in hospital when they don't need to be there? What can we do to get them out?
And just finally, yesterday, Tuesday, NHS providers were out there saying you should wear a mask if you feel that you've got symptoms that present like cold, flu on public transport. They were talking about, do the right thing to protect the NHS. It was striking on some of the news channels I was listening to, the public response to saying, we're tired of this narrative that we've got to protect the NHS. It came through quite loud and clear, actually, on a number of channels I was listening to. Where are you on this, Adrian, at the moment? Because, the NHS is stretched. It's got more and more tax pounds than ever before. And now we're being told to wear masks again. How do you feel the public are responding to that kind of messaging?
Well, I think it's become divisive, and it's one of those things that will put people into one of two camps. I can absolutely understand that we mustn't fetishize the NHS, and it's not, I know people say, oh, you've got to protect it. It's a service. It's there to try and serve us. Now, there's a bit about responsible use, and there's a bit about people taking responsibility for their own health. There's also a bit about people taking responsibility for other people's health. There's a sort of slightly bonkers lunacy that goes around mask wearing. Wearing a mask is not desperately unpleasant. And some of the stuff that I see people saying, oh, it's absolutely appalling to wear a mask. Surgeons do our 12-hour operations with a mask on their face and do them really well. It's not actually that big a deal.
Yeah.
So I think people just need to just take a sense of perspective. But masks are one bit of the prevention control. Hand washing, vaccination, good ventilation, and you know what? Not people joining people in corridors are next to each other,
Yeah.
so they pick up infections.
Yeah.
There's a lot more to this. A wise friend of me told me that look at the PPE we wear in hospitals a bit like the uniforms that fire service wear when they go into burning buildings. Now, the most important that you can do if you're a fireman is not go into a burning building.
Yeah. Yeah. Or hang out in a corridor.
Adrian,
Yeah,
look, we'll let you get back to it because we're very grateful for you taking time out from the front line to talk to us. We'll see you again soon.
Brilliant. Adrian,
always a
thank
pleasure.
you.
Thank you.
Okay, mate. Brilliant. Thanks so much. That was 10 minutes. We'll let you disconnect.
Brilliant. Thank you.
Thank you.
Take
Bye.
care. Bye
Cheers,
bye.
Adrian. Bye. There he goes. Perfect. Okay, right. Let's go back to the top. Actually, no, let's just record the back end of him.
Yeah.
Um, just got to get this right in the right
And
order.
was that repartee between us?
Yes,
Okay. Were you happy with that?
and we didn't talk over each other,
No,
so
we
which was
didn't.
excellent.
Yeah.
So let's just do the back anno to that, which will be us just riffing off what he said and masks, and I give my experience of the tube this morning with my mask on. And then I'll end
On the
that
mask,
by
I don't know if you want to go into this, but there's just a big difference between asking people to wear a mask if they've got a cold to prevent themselves from giving the cold to everyone else.
yeah, but I don't have a cold and I was wearing one this morning.
Yeah, no, well, that's very
So I don't
good.
want to get one.
Yeah,
But anyway,
yeah,
and then at the end of that, off the back of him, I'll say, right, let's take a break, and then we'll have a quick conversation about the maternity thing, and then we'll do our end of year reflections predictions.
yeah. Okay.
So okay, right. Three, two, one. Very kind of Adrian to join us, James, wasn't it? He's a busy man, taking him away from the day job. But yeah, what
He,
do you reflect on what he had to say?
well, he was raising a red flag, and he is a very articulate and forthright president, and he's not shy of going on the Today program and making his case. But I was quite struck that it's very early in December, and he's already expressing anxiety about the resilience of the system, and winter's hardly begun. I hope he's wrong, but we could be in for a rocky road.
And we didn't touch on the resident doctors' strike, partly because we're, of course, recording this on Wednesday afternoon. There is, on Wednesday evening, a statement in the House of Commons from the Secretary of State. Who knows? Nobody seems to know what's going to be said about resident doctors' industrial action. Potentially, there's going to be some movement. Maybe a compromise has been sought, or even a Christmas truce. But I mean, clearly that is not going to make it any easier for the NHS. On masks, because I was asking him about that, wasn't I? I was on the tube this morning wearing my Back to the Future mask, which always gets.
Yeah,
But interestingly, I don't have a cold. Touch wood. I don't have any symptoms of influenza at the moment. I had it a few weeks ago, but I was wearing a mask because I don't want to get one. But I was the only person on a packed tube carriage that was wearing one.
yeah.
What's your view? Where are you on mask gate?
Oh my God. I can't tell you how much time I've spent looking at science around masks. And
Yeah.
during the pandemic, we looked at this a lot. And a lot of these things aren't clear, and I don't want to sound overly emphatic. This is really a personal point of view. My rough rule of thumb is that as a piece of protection against infection, the surgical mask is not a very effective barrier against viruses. So good for you for doing that, but I'm not sure how useful that was. You need a proper FFP3 mask if you really want to protect yourselves. However, if you are carrying a virus, if you do have a cold, it's a very good courtesy to everyone else. And this is the bit that people misunderstand about Asia. In Asia, where I go a lot, people are wearing masks because it's a courtesy to other people. Much like if you and I sneezed in a pub, we'd put our hands over our mouths, or we would put our faces into our inner elbow. That's the courteous thing, and that feels very British. And I'm a little bit surprised that there's been this confusion between protection and prevention. So I'm pro masks for prevention, skeptical about protection.
I know it's interesting, isn't it, with the whole the Asian experience, as you say. I think it's a really wise way to do it, and as you say, it's just polite. I suppose at the end of the day, what we see here in the Northern Hemisphere is what presented in the Southern Hemisphere, and we always remember that as ministers that we were told how the influenza outbreak was that in their winter, which is of course now they're now in summer. But it has migrated a bit, and I was struck by what Adrian said, just finishing on this, about the variable rates of vaccination among
I
NHS
know.
staff
That
themselves.
was interesting.
We are so poor as a system at offering healthcare to
Yeah.
healthcare workers, aren't we?
I know. This healthcare worker thing is frankly baffling to me. I get that some of them might feel exhausted with vaccines. I get that there are some toxic atmospheres and environments in some hospitals where people who work there are just fed up with being told what to do. And this is either a form of exhaustion or protest or both. But it's dead weird to have so many, 60% of NHS staff going into work without having a vaccine when that's such a basic tenet of good practice. And for it to be quite so variable, both within hospitals and within cohorts within hospitals. There's something going on here that we're missing. And it's really regretful because nosocomial infection, the infections you get in hospital, they are A, very, very common, far too common, and B, devastating because you've probably already got a damaged immune system and your resilience is low. So we need to fix it. I wish it was higher up the agenda.
I've got a solution to
Go
my
on.
tube mask wearing. It's called a Lime bike.
Yeah, absolutely.
As you know,
Yeah, I
James,
know.
I am a Lime bike convert.
Yeah, me
Other
too.
bikes are available, which happened during the tube strike earlier this
Yeah.
year, and so I had no choice but to use one. The only reason I used the tube this morning is because I forgot my cycle helmet, and I really don't think riding one in London without a cycle helmet is a very good idea.
No, I don't
But
agree with you. I think cycle helmets are victim blaming.
oh, I like this. Why are
Yeah,
they victim blaming?
you're just being crushed by the establishment view that bike accidents are bicyclists' fault. They're not. They're motorists' fault. And if motorists were considerate, there wouldn't be a need for you to wear your helmet.
But that's my point. They're not. So it's not. I mean, when I used to have a
Oh.
motorbike when I was 16, we could discuss this one day about my leather wearing days. I had long hair then as well. But anyway, digress. Of course, it wasn't what you did on the motorbike. It was what the drivers did. And so I always think, well, look, if I've got my cycle helmet, then I feel happier if I come off. And I certainly would be if I came off and landed on my head.
But we have a 20-mile-an-hour speed limit. And to be fair, even taxi drivers have changed their attitudes a lot. It isn't quite like when we were teenagers and getting on a bicycle in London was a sort of suicide mission.
No, you're right. I suppose there is a mass penetration now. Anyway, interesting. Right, let's take a quick break, and then we're going to come back and just touch on the maternity story that has also been dominating the news headlines this week. And then it's a chance for us to have our reviews of the year and our look ahead to next. Welcome back. Health and Politics Podcast. Prevention is the new cure. That's what you're listening to. James, maternity. My goodness. It just feels a bit to me like so many of the things that we believe in as a country. Church of England seen its
Yeah.
leader change this year. The BBC seen its top dog resign this year.
Yeah.
And the NHS is just being dragged from one problem, one crisis to the next. So a few months ago, the Secretary of State launched this big review into maternity services. There is also concurrently a review into maternity services specifically in Nottinghamshire and specifically in Shrewsbury. The former, the sort of nationwide maternity review, is being done by Baroness Amos, who presumably you sit with in the Lords.
Brilliant.
And then the latter, looking at Nottingham and Shrewsbury, has been looked at specifically by Donna Ockenden, who did the last big maternity review for the last government. And in a nutshell, Baroness Amos has released, I suppose, her reflections, is how she describes it, sort of her initial report, if you like. And she says it's been much worse than she anticipated. That's the story that hit the news yesterday. You saw this, I'm sure. There are all sorts of terrible anecdote stories coming out from people who put in complaints and responded to the Amos review so far. It's really, really bad, isn't it?
Okay. Steve, the science around maternity is really strong. We know how to do good maternity. It is one of those procedures within a hospital that is fraught with danger. And the process itself is inherently complicated and difficult. But my goodness, we've given enough birth to enough babies in the Western world to know how to do it properly. And Britain is a leading expert in this. So when you read these stories, my heart just sinks as to how on earth we get it wrong. And it speaks to problems around the culture within a lot of these hospitals where nurses, maternity wings, and the consultants seemingly are in some ideological war with each other about the best ways of doing the science. It speaks of inability by the NHS to really tackle tricky problems and to drive through changes. Don Ockendon's report, it's all in there. Baroness Amos says quite clearly that there's nothing that she's seen that can't be dealt with by the recommendations in the Ockendon report. They just haven't been seen through. So why is it in the NHS it is such a problem to see through recommendations? In other industries, in transport, in the military, when you have a report that has clear recommendations, they are done or heads roll. But sometimes in the NHS, it's the same problem rolling on for year after year. So I think this is a big one. It speaks to the absolute worst fears of patients and to the core of the brand of the NHS. So we desperately need to get this fixed.
So this is a mess. Many people, let's be honest, many people think that Donna Ockenden should be doing this nationwide maternity review. Many of the families involved think that it should be a judge-led national inquiry with all under the terms of the Inquiry Act, able to compel witnesses, etc., etc. I mean, that's a debate. The thing about Baroness Amos, I don't know her, but the BBC Social Affairs correspondent was on the media yesterday, and he asked Baroness Amos why it would be different this time. And her answer was, well, because we have Wes Streeting as a Secretary of State. Well, I think you could have asked any reviewer that over the last 20 years who would have said, well, I'm sure the Secretary of State will take my recommendation seriously, and on we go. In 2022, the Ockenden Review presented, as she said yesterday, Donna has said yesterday, all these recommendations accepted by the then government, accepted by the then opposition, led by Wes Streeting, the then Shadow Secretary of State, and absolutely none of them have been implemented. We were doing on the select committee a piece of work on leadership in the NHS. And one of the things that sat behind that in our terms of reference was, how do we keep having these reviews and these recommendations and these inquiries that often come up with the same recommendations time after time, and they're still not implemented. And it can only be, I think, because of leadership, either poor leadership or constant change of leadership politically or out there in systems and in trusts. And it just isn't good enough. And that's why I say that I wonder what we believe in as a country anymore, because the BBC, the Church of England, but particularly the NHS, it's a national religion. The closest thing we have to a national religion, as famously said. And we don't seem to be able to believe in it right now, James. And I think it's hugely undermining.
I think that's true, but I would step back a little bit. On the leadership thing, I think you're absolutely right that it's key. There is another problem, which is blurred leadership. And a slight problem or a challenge when you have politicians who ultimately are responsible for the health system, you get clinicians looking up to the politicians to fix problems. This paternity issue does not feel like one that the politicians are going to have the answer for. This is about clinical practice and about teamwork and about the way in which quite complicated teams and lots of contributors from different backgrounds, different training, different worldviews, have got to somehow figure out a way to chip in together. There's no Secretary of State who can make that happen. So where is it within the NHS that we're seeing the leadership to make this really happen? And why isn't the finger being pointed at those who are responsible for letting it slip? I just don't think this is up to a Jeremy Hunt or a Wes Streeting or Wes Streeting's successor to be able to fix. NHS colleagues have really got to step up and own it.
And just finally on this, James Titcombe, who I'm sure you know, long-standing maternity safety campaign, he lost his son Joshua back in 2008. He said this yesterday about the issues that Baroness Amos identified. He said they mirror long-standing problems we've known about for years.
Yeah.
And that really just sums it up, doesn't it? This is a story that I think next year we're going to come back to again and again. And on that point, seeing as this is our last episode of the year together, there will be one more episode of Prevention is the New Cure before Christmas, which we'll come on to at the end. But seeing as this is our last episode together, we thought what we would do is look in our own mirror and reflect on a few things from 2025, and then look ahead to next year and give out some end of year gongs. So 2025 reflections, James, you go first.
Well, bluntly, it was the year of missed opportunities. It was the big year of drift. We had an amazing election with a new government with 185 majority, and a very clear manifesto on addressing the health system, which I think the Guild of former health ministers pretty much universally supported. The three shifts, well, that could have been any political party's program, and an enormous amount of goodwill. But I don't want to reel off the whole list, but boy, oh boy, missed opportunity after missed opportunity for turning things around. And that's just been the consistent theme all the way through, from the opportunity to have a really sincere conversation with the doctors over their pay rise, through to the 10-year plan having a really clear implementation program attached to it, to Palantir being a program that could drive change all the way through the whole health system, not simply driving a little corner of it. I'm falling into the trap of reading off the list. I'm just going to depress myself and the listeners. But that would be, frankly, the dominant theme.
Yeah. I'll try and provide some balance,
Thank
okay?
you.
And I will be uncharacteristically generous. So I suppose what ministers would point to, and the Prime Minister did this lunchtime at Prime Minister's Questions, they would probably point to 5 million additional NHS appointments this year, or since they've been in office. They'd probably point to more GPs. First GP contract that's been agreed in 4 years, i.e. not been imposed as I had to do. They would probably point to 250,000 people off the waiting list. We've discussed this before. A lot of that's down to cleaning up the data, people either going elsewhere or no longer needing that procedure. And I'll just say my experience on this is that I have an outpatient appointment in January, which I've had in the diary for absolutely ages. I've in the last 5-6 weeks, I've had a phone call every single week from that provider asking me if I can come in this Saturday to bring it forward and to get it done. And
Good.
I've been quite, and I haven't been able to at any point, and it's not urgent, so I'll leave it till January. But actually, that just shows how much effort and intensity is going in to sort of beat down the list. So I would say that there has been people come off the waiting list. There's been big money uplift this year in the resource limits, as we call it in the department. There's been big uplift in the capital spend, particularly on tech and digital transformation. They've announced the Casey Commission into social care, and they've finally published the 10-year plan. So that's probably what ministers would say on the positive side of the ledger. But there's always a but, isn't there? So when it comes to waiting time, I said they've cleaned up a lot of the data, and they have. But the Public Health Committee said just July of this year that it's still their program for elective care has still failed by significant margins. For diagnostic tests, I think about 22% of patients are waiting more than 6 weeks for scans or other diagnostics, and that's way higher than the operational standard that should be 1%. I think it's about 59% of patients are treated within the 18 weeks now of referral. That's obviously well short of the government's target of which is 92% by 2029, so the end of the parliament. So there's a huge amount of work to do. And sort of looking in the mirror on 2025, I think I agree with you. For all sorts of reasons, the industrial action has sort of been part of it, but I don't think you can particularly blame that. It has been a missed opportunity. And just finally on this, the Prime Minister I heard again at PMQs today, and I've heard him say this many times, it's a political knockabout point, of course, is that austerity brought the NHS to its knees, and we've turned our back on that and turned the page on that. I think to those people being made, 18,000 people being made redundant, the 50% cut out there in ICB land, turning our back on austerity feels like a soundbite too far, doesn't it?
I know.
Anyway, that's 2025. Person or institution of 2025, who would you nominate?
I think it has to be GLP-1.
Okay.
And I'll tell you why it has to be the GLP-1. Because for me, but as you know, I'm a sort of outcome guy, and your list of process achievements is entirely right. I mean, those are concrete achievements, but there is a deterioration in the overall outcomes for the majority of people in the UK. And we're not the bit that I feel where there's a gap strongly is we're not giving people the chance to lead healthier lives, except in this one area where there has been this remarkable drug that people have seen work for themselves with their own eyes and have embraced for themselves. 2.5 million people, mainly on private, but a bit on the NHS as well. I am cheered enormously that people are stepping forward, owning their health, taking the drugs, improving their outcomes massively, and in doing so are engaging with their long-term prospects in a massive way, which opens to the door to them thinking about other aspects of their health and completely rebooting their whole mentality, and definitely not looking to the NHS to solve every single problem they've got. I'm really inspired by that. Now, the NHS we need to make sure that this isn't a massive inequality story. And most of those 2.5 million are either prosperous or at least aspirational. We need to make sure that these drugs get into all parts of our society. But I'm just thrilled to see this incredible revolution of people owning their health in this way.
Okay. You've gone for a thing, a drugs. I'm going to go for a person. I'm going to be totally predictable. Person of the year. I'm going to go for Wes Streeting, the Secretary
Okay.
of State. And I've always said to clients, and since I've left the house and he's become health secretary, I totally respect him as a person. I know him and like him as a person. We served on the HIV commission together. I think he's a good person. He's got a good heart. I respect him as a politician. Winning that seat the way that he did, very, very tough challenge from a Gaza party, wasn't easy in Ilford. So I think he, as a political operator, I respect him in that sense, and I'll come on to a bit more on that in just a second. Do I respect him as a Secretary of State? I think it's impossible to say because I just don't think we can yet see the outcome of his labours. So I think he does want out sooner rather than later of DH. And there was many rumours that during the reshuffle earlier this year, he was desperate to be moved to the Home Office. Not many people are desperate to go to the Home Office, but
Yeah, right.
that is what they say on the Westminster Grapevine. But I think why would I nominate him for that? I just think he is the dominant figure in health. I mean, I was at Confed this year. I've been at other conferences where I've seen him, and he, like him or otherwise, he is a very dominant figure in the health landscape at the moment. But he's
Yeah.
also, which is very important, of course, if you're the health secretary, he's a very dominant figure in the politics of this Labour government, isn't he? When he said in the lead up to the budget that he thought politicians should keep their manifesto promises, it was probably 24 hours later they decided to say, oh yes, we won't be breaking our manifesto promise on income tax. And I think he's clearly carrying strong weight inside government because they respect him as a communicator, and presumably this Downing Street respect him as a potential challenger to the Prime Minister should things go wrong next year. So I suppose person of the year in health and politics for me, it's Wes Streeting.
Yeah, no, I think that's a fair assessment. He's also, I don't think any of us doubt his capability. There's no question that he doesn't understand the issues and doesn't want to try to do probably many of the same things that you and I aspire to. And I can't think of anyone who has a better chance of wrestling with the politics of it all. He is a heavyweight, firmly embedded with the Chancellor and the Prime Minister. And yeah, if he does go, which I basically hope he doesn't, they will look back at this as being a foundational year.
Yeah. Do you want the next gong
Go on then.
that we're going to give out? Unwrap this one. Most significant moment of 2025.
Yeah, but I think the 10-year plan should be like the Bible, and something that goes that is assumed and is um, not of it. Steve, you go ahead.
So I'm going to say the decision that came completely out of the blue which was to abolish NHS England.
Yeah, yeah,
I'm going to say something unpopular here, because I know everybody in Parliament, including the Conservative opposition, all say, well, of course we should abolish NHS England and we wish we'd done it. I think it's a decision they'll live to regret. I'm not saying they didn't get bloated COVID years and since, when it hasn't shrunk back again. They definitely had a problem with there being two press offices. Well, okay, get rid of one of the press offices. I think that Wes was right in opposition to say that structural reform and reorganisation will be a, quotes, massive distraction, end quote. And I think he will live to regret doing it. I think it will take the best part of this parliament to settle down. I think it is distracting out there in terms of transformation and implementing the Bible that is the 10-year plan. And of course, the finances of it. I mean, it's being sold as saving money. It's being sold as returning democratic accountability to DH away from this unelectable, unaccountable behemoth that is NHS England. I don't believe it will do the latter. And we already know that it's going to cost at least £1 billion in the redundancy payments.
yeah.
So, for that alone, and of course, the fact that I think it represents an element of overstretch, which I think this department and this Secretary of State definitely can be guilty of. Overstretch in terms of just their sheer capability as ministers to deal with this much stuff on your plate. And we know as ministers how much stuff's on our plate on a day-to-day basis. Just doing the day job without all of this other stuff. So I think the most significant moment of health and politics in this parliament will be the decision to abolish NHS England.
Yeah, no, I think there is a chance that we'll look back at it like we look back at the Landsby reforms as something that was sort of half a good idea, but wasn't thought through nearly well enough, and actually has been incredibly disruptive.
Yeah. So what's your most significant moment?
Well, I approached this question completely differently because I saw it through. I was going to say what the most significant moment was for me personally.
Oh, okay.
So I think you've made a really good case. I think you've probably won this one. But I'll tell you, listen, in a heartfelt way, I had one conversation that really changed my outlook on health big time. It was 2 months ago in Washington, D.C. We got a briefing from Mike Milken at the Milken Institute, where I'm a fellow. And he had just had a series of engagements, including with the White House. And I'm summarizing quite a nuanced 1 hour presentation here. But the two things that completely changed my view on two subjects. Firstly, he said that the power balance had now, in terms of progress and innovation in the world of health, had shifted away from clinicians and the big research organizations, Pfizer, AstraZeneca, and so on, to the tech companies, to the AI companies with their huge amount of data that they're putting into population health data, bending proteins. Every single bit of the health chain is now being scrutinized and rewritten by the tech companies. Now, my previous mentality was that the tech companies had potential, but on the whole, didn't have a commitment to empiricism, didn't really understand clinical complexity, and quite often were slight wannabe doctors, like I used to be wannabe DJs when I was at the Ministry of Sound. In other words, important partners, but absolutely not in the lead. I was persuaded that we're actually going to see big changes driven by the AI companies with their absolutely humongous budgets, which are often much bigger than the pharma companies or even state research organizations like NIHR, that they're really going to do a lot of the running, and we should take them all a lot more seriously. The second thing he said was that the kind of esoteric longevity bit. So we're all interested. Well, this is the prevention show, right? We're interested in prevention, but I am a little bit hesitant about mitochondria and elixir of life and the rewriting of our genomes in a way that might lead to us leading 200-year lives. When I talk about health, I'm really saying the last 10, 20, 30 years of your life should be more healthy than it was for the former generation. I was persuaded that actually advances are coming through that are going to extend the final deadline for a lot of people, that our children aren't going to just live to 100, they may well live to 200. And in particular, that these mega billionaires, the Zuckerbergs, the Ellisons, they're going to spend so much money because they're personally vested in the living forever promise that they're actually going to use their technology to unpick this. So it's quite a radical thought. So I am now, and in the year ahead, spending more time thinking about meeting and trying to understand the elixir of life stuff than I would have done in the past.
Love it. Okay, final one. Not so easy. Prediction for 2026.
Well, I've slightly combined
Preempted
it. So
yourself.
my two predictions are firstly that the AI companies are going to make a lot of the running in terms of innovation and pioneering next year, and that we're going to see remarkable breakthrough, which we haven't really. I mean, a lot of tech has been SaaS support for pharma back end. A lot of it's been quite low grade. Actually, we're going to see them uh, doing the running at the lab bench. And secondly, that we're going to start hearing a drumbeat of not just interventions on chronic disease that manage to grind out better outcomes in the later years of our life, but actually start pushing forward the finishing line.
What do we reckon the chances are of a new health secretary in 2026?
Ah, well, there we go.
50-50 or higher?
Definitely, yeah, higher, definitely,
Yeah,
75.
I agree. I wonder who that could be, though. I mean, goodness, there are many names in the frame. There are some junior ministers, of course, in health department, but they never seem to step up and get the top job directly, do they? On predictions, difficult, isn't it, for politicians? I would say, and I sort of touched on this as well in the discussion about maternity, is that I think the big challenge next year is going to be one of belief. I think it's the belief that the public have, the risk appetite the public have for more and
Mm.
more of their taxpayer pounds to be spent on the NHS when they don't feel whether the stat whatever the stats say, they don't feel they're seeing the results of that at the front end when they want GP appointments, dental appointments, child adolescent mental health services, and ambulance turning up on time, although those figures are going in the right direction. So I think the public risk appetite is
Yeah.
going to be continued to be questioned. And actually, I predict that the main opposition, will really ramp up that point. And I know that reform will ramp up that point next year. So I think it's going to be a big challenge for whoever is health secretary to keep the public on Team NHS, because although public support for the NHS remains strong, I think it's being challenged like never before. And the maternity story that we were discussing is an example of that. So
Yes.
that's sort of my prediction for next year. Maybe that's a bit grand.
No, I think that's a good one. And if I can build on it, I've been keeping an eye on two things that may well come. Firstly, is a British version of the Maha Mums. It won't be the same as in America, where there's a radicalism and a anti-empiricism and an anti-vaxism that we don't really have in the UK. But I look at things like the battle over smartphones in schools and the ed tech and the technology battle. I look at what you were saying about maternity safety, and in fact, a lot of safety. Uh, there is going to be, I think, and also food and the growth of fried chicken throughout British society. I think there's going to be an anger amongst a core voting demographic, that for all of our commitment to the NHS, actually the ability of parents to bring up healthy children is so frustrating and frankly not going very well, that that's going to become an electoral force. And secondly, on your point, this question of NHS waste has been lurking around for a long, long time. We spend too much medicine gets thrown away and unused. Too many people who don't pay British taxes are getting a free ride, and that big number that keeps cropping up every year still doesn't get dealt with. The money that gets spent on infrastructure, we should spend more on infrastructure, but you could go on a tour of the NHS and look at some things and wonder to yourself, how on earth did tens, hundreds of millions of pounds get spent on that? We largely avoid talking about NHS waste, but in the 220 billion quid spent on health, you can absolutely be sure that not every pound of it is spent well. And I just wonder whether the waste conversation does eventually go mainstream. partly because the opposition might want to touch it. It is an electric subject. Reform will definitely want to go there. And maybe because its time has come. We can't, we have run out of money as a country, and we can't avoid scrutiny of this big spending department.
Yeah, it's good that you mentioned the word scrutiny, because I think there will be increased scrutiny this year of health ministers and the government's health policy. I'm told that for all of the machinations around resident doctor strikes, there has been barely a UQ on the subject, an urgent question in the Commons. There was urgent questions week after week.
Yeah.
During the last government. That hasn't happened. The scrutiny for Wes and his ministers has really been at health questions, and that's been it. I think that will change next year. The opposition are more confident. Kemi Badenoch is doing better. She's had a good autumn. I don't think anyone could doubt that. So I think the scrutiny will turn up, and Wes, well, I think that makes you better as a minister. I think Wes should welcome it. I mean, I was at the box constantly doing urgent questions, or in Westminster Hall answering debates. It made me better. Made me better at my job.
License when you go and negotiate with your own department.
Look, believe it or not, we've been talking for the best part of an hour. So I suppose we better close it for us for this year. Couple of things, couple of parish notices, Reverend Bethell, from Vicar Brine. So on Monday, the 22nd of December, I will be putting out a Christmas special with myself and dear Dr. Helen Stokes Lampard, who is zooming in all the way from New Zealand. I know you'll be away by then, but I'm going to have a quick chat with her, resuming our original partnership. So those who were fans of Helen, you will hear her on the 22nd of December. You and I are back on the 8th of January with our next episode together. And little Christmas surprise for you is that Henry Dimbleby is going to be joining us that day, who is a friend of yours and a friend of mine, I hope. And he's going to be joining us to talk about all of the work that he did with the last government around food and the role that that plays in our health and our wealth. So, yeah, he'll be talking to Henry on the 8th of January. And much, much more next year from us. We've got so much that we're going to do together, and so many things that we want to talk about around the health, politics and prevention. And I think you gave us a little sneak preview there into the Make America Healthy Again, which we're very interested in spinning off to, aren't we, as well?
We are. That's right. Fantastic.
Absolutely.
Well, that's a lot to be looking forward to. Steve, I'm really enjoying doing this with you. So,
likewise.
Yeah, 2026 is going to be brilliant. Thank you.
Have a happy Christmas, James. And you can email us. Prevention is the New Cure podcast, all one word, at gmail.com. You can find us on all the usual social media channels. And until next time, and for you and me, James, until next year, see you soon.
Have a great Christmas.
Bye. Right. There you go. It was a bit of a challenge. I think I have a bit of an editing job.